We all like to think that when our lives are disrupted by the unexpected, things will get back to normal. Soon, we hope, we'll be able to pick up where we left off. But hoping doesn't make it so. Sometimes we need to depend on others to help us make the transition from what was to what is to what will be. That's why Select Specialty Hospitals were created. Select Specialty is a leading national provider of specialized acute care services for those patients needing a longer length of stay in the hospital. Select Specialty Hospitals operate with a long-term acute care hospital licensure. They offer a similar level of care as a short-term acute hospital. But the difference is that patients who come to Select Specialty typically need to spend weeks, not days, in a hospital setting. Like Select Specialty patient Esther Loeb. She went into the hospital to have a blockage in her digestive tract removed. The surgery was successful, but she developed breathing problems and had to be put on a ventilator. She was transferred to Select Specialty for further specialized care.
And I was over 25 days on my back with the ventilator, and it was horrible. It was really, I suffered terribly. But you know, the help was so wonderful. They have a part in my heart. They really do, because they done wonders, and they really put me together, come to think of it. And look at me now, here I am.
At all of our Select Specialty hospitals, we provide superior care with state-of-the-art equipment for patients with a wide variety of complex conditions, like respiratory complications. For patients with serious breathing problems, we offer advanced pulmonary treatments. Board-certified pulmonologists supervise each patient's treatment plan, while respiratory therapists are available around the clock to administer the care. Like they were when Select Specialty patient Gerald Davis arrived. Gerald suffered from a series of medical complications related to a lung transplant when he came to Select Specialty.
I was in a horrible mood. I just got my transplant, I just lost it. I just started my way up, and now I'm on my way down, and I'm back in the point where I can't breathe, I can't do much. So I was pretty ticked off to be coming to Select Specialty or any place else for that matter. But when I got here, I have to say it was a very warm welcome. I was on the brink of death. My initial transplant had failed. They had put me in Select Specialty in the hopes that I would recover far more than I did. I did recover a great deal. While I was at Select Specialty, I got strong enough and well enough at least to be able to care for myself at home.
Without warning, Select Specialty patient Joanne developed a serious infection that attacked her whole body. After spending time in 3 different hospitals, she came to a Select Specialty hospital.
I understood before I went there that Select Specialty gives you extra better care, and that's what Dr. Diamond said I needed at that point. And they did. They gave me the kind of care I should have had in the other 3 hospitals.
By the time Joanne reached Select Specialty, the infection had taken its toll. She lost many of her fingers and toes. But with the compassionate care of Select staff, Joanne learned how to walk, talk, and eat again. And now she's back to playing the piano, one of her favorite hobbies.
The difference between Select Specialty Hospital and the run-of-the-mill hospital is I think they were more caring, and they were always there for me. I went back to Select many times after I left that hospital because I felt an attachment there. Honestly, like it was my home. I had to come back and see those girls again.
We treat patients with neurological or post-trauma conditions, like brain injuries or strokes. We are also specialists in the treatment of large or serious wounds. We have specialized equipment to promote healing of complex wounds or wounds that are slow to heal. There's also another category of patients we treat, those that have what are called medically complex conditions. That is, they have new health challenges that are combined with chronic illnesses like diabetes and kidney failure. For every patient, the Select Specialty Hospital staff applies an integrated approach to treatment. Teams of specialized physicians, nurses, respiratory therapists, pharmacists, physical and occupational therapists, and others provide an effective combination of highly personalized and resource-intensive care. A select specialty team was ready when Evelyn Ford's husband, Claude, arrived. He had been transferred from a local hospital ICU with respiratory failure.
In ICU, I think you have more one-on-one nurses, but they can't do for you there what Select can as far as the respiratory specialist. And I think that the respiratory specialist at Select, they know exactly what they need to do and how they need to progress with the patients. If you're going to be sick, it's a good place to be.
As a patient, you receive high-quality care because we care. To ease the mind of patients and their families, case managers are assigned to each patient to ensure everyone understands and approves of the team's treatment plan. Select specialty hospitals are fully accredited as a long-term acute care facility for patients with medically complex needs and are completely dedicated to the practice of healing. Our compassionate and skilled caregivers have one primary goal: to help patients return to the most productive and fulfilling life possible. For Select specialty patient Dorothy Knopsnyder, it was a long way back from the brink. Dorothy had extensive heart surgery. When she arrived at Select Specialty Hospital, she was on a ventilator. Her kidneys were shutting down. She had pneumonia. She had a feeding tube and a trach. Doctors didn't expect her to live.
I was very afraid. I'm thinking all the things that I had gone through, I thought they were sending me there to die. Are they going to be equipped to help me if something would happen? Is it going to be smaller? Is it not going to be up to standard? I was very afraid. Am I going to get my oxygen there? That was a big fear of mine because I wanted to breathe, and I was afraid. That was the whole thing. I was just afraid they're not going to be able to take care of me.
But the Select staff changed Dorothy's thinking.
Select specialties, they helped me get off the ventilator. They weaned me off of my tracheotomy. Select specialties got me eating again. They got me walking again, talking again. So I owe my life to them. They're the ones that really got me where I am today.
Select Specialty Hospitals, your national provider of high-quality medical care for you or your loved ones who require extended hospitalization. Select Specialty Hospitals.
If you need it, take my word for it. This is the place to go, and they'll save you. Not only the doctors are great, the help is great, and they know what they're doing. Honestly, they do.